Good morning, everyone, and welcome. I'm Joe Ruffalo. I am the general manager for The Hill, and we're very excited to have you all here, both online and in person, for our very important event today, Mind the Gap, the Cost of Mental Health Disparities. I'd like to thank our sponsors, Otska, for their support of this very important discussion. We're here today to mark Minority Mental Health Awareness Month. Chances are, if you're tuning in, or if you're here in the audience, you already know that 1 in 5 U.S. adults live with mental illness, and access to treatment remains a challenge. This is especially true for lower income individuals and minority populations, exacerbating the economic hardships they already face, making treatment even less likely. A new report from the School of Global Health at Meharry Medical College examines the projected impact on the U.S. economy if mental health inequities are not addressed, and the findings are staggering. We'll dive into them in detail in a few minutes. But first, we'll hear from 2 leading voices in Congress who have been very outspoken on the topic of mental illness, especially as it affects minority groups. And we'll be joined later in the program by other experts, doctors, and mental health advocates to discuss a path forward in closing the gap. Before we get underway, a few housekeeping items. If you're in the audience, please silence your cell phones, but we do encourage you all to join the conversation online. You can follow us on Facebook, X, and Instagram at The Hill Events using the hashtag #TheHillMentalHealth. And with that, I'm delighted to introduce our first guest, Congressman Ritchie Torres, a Democrat from New York and founder of the Clubhouse Caucus, as well as Congresswoman Lisa McClain of Michigan, co-chair of the Bipartisan Task Force on Mental Health and Substance Use Disorder. They are joined by our very own and very talented Cheyanne Daniels, race and politics reporter at The Hill. Welcome.
Thank you all so much for joining us. Congresswoman, Congressman, thank you both so much for being here. We are about to engage in a very important conversation. Want to start off, you have both been very open about talking about mental health and connecting to a common thread with other members of Congress on this topic. And that's what brought you both here today. So can you both share a little bit about why the conversation around mental health is so important and personal to you?
Yeah, I'll just start with my story. I had a personal event happen in my life, and I think it has to do with mental health. I think it has to do with addiction. I grew up in a small community, Romeo. Everyone was a tight-knit community. I was extremely involved, right? And one of my best friends, her son, passed away. He committed suicide. Now, I don't, the jury's still out. Did he mean to? But it was an opioid overdose. I don't think he woke up one night and took a bunch of pills. I think I think he was suffering for a long time. And I was angry. Like, I was so angry. And then I figured out, but I didn't know who I was angry at, right? I was angry. And then I stopped for a moment, and I think the anger came from, I was angry at myself. I mean, this was a family, this was a child who was at my home for Christmas, for Thanksgiving. And I was so blind to it that I didn't see it, not one indication. I mean, that's on me, right? That's embarrassing. And, there's a lot more to the story. We had the funeral, we had the wake at our house, and one of his best friends, to add insult to injury, it was the third day. Everyone was kind of celebrating life, let's just say that. And here's this young man in the corner bawling his eyes out. And I knew him, his name was Barrick. And I said, Barrick, what's the matter? And he's like, Ricky, the gentleman, the young boy that passed away, he's like, he was my best friend. And I said, okay, well, we'll get through it, I'll get through it. Just completely oblivious. Completely oblivious. Now, if you were to ask me, I was pretty tuned in. Like, I was the mom that was at school, right? I was tuned in. And he started crying, and I mean, he's bawling. And to put things in perspective, he's like 6'7", and he's just bawling his eyes out. And I'm like, what is the matter? Come to find out, he's like, Mama Lisa, he says, I don't have anywhere to go. I said, what do you mean you don't have anywhere to go? His mom's incarcerated, and his dad is a drug addict on the street. There again, I'm like, how do I, this kid is in my home, this child is in my home, right? So, you know, I may have had too much to drink that night or whatever, but I'd said, oh honey, you can come live with me. And the next morning, he woke up and he's like, did you mean that, Mama Lisa? And I said, absolutely. Now, it would have been nice if I told my husband. Right? Because we had 3 other kids in the house. But Barrick's a part of our family, and we are truly blessed to have him. But I think the problem, and I know we don't, this is why I have such a connection, is I was angry. And I could either be angry, which I was, or I could do something about it. So I started the drug court, right? I started talking to the kids, but I think the biggest thing I did was I opened my own eyes. And that's embarrassing to say. I mean, but it's the truth. I think that's the biggest problem in society today is people like me. I mean, really. You know, I got to get the mirror out and I got to look in the mirror. How could these kids and these people be part of my life? And I am so blind. I am so arrogant. I don't even see it. Shame on me. So that's why, I mean, I started the drug court and I'm on this task force and I want to do something about it. Sometimes I don't know what, but I want to do something.
Congresswoman, thank you so much for sharing that. And our hearts go out to you and your family, and you're so wonderful for helping that young man.
We are blessed, and I mean that from the bottom of our heart. I mean, the blessings and the education that Barrick has shared with my kids. I mean, the stuff my kids complain about, I don't need to deal with them. I just tell Barrick, go in and get them. And he gets them.
Congressman, why is this conversation so personal for you, for us to make these changes?
Well, for me, mental health strikes close to home. I have struggled with depression for most of my life. Every morning I take an antidepressant, Wellbutrin XL, 150 milligrams, and I feel no shame in admitting it. I feel like mental health is nothing of which to be ashamed. It enables me to be the best version of myself, a productive public servant. About 15 years ago, I was at the lowest point of my life. I had dropped out of college, found myself struggling with depression, abusing substances. I even attempted suicide and underwent hospitalization for a period of time. And I never thought I would rebuild my life and 7 years later become the youngest elected official in America's largest city, and then 7 years later become a member of the United States Congress. But I can honestly tell you, I would not be alive today, let alone in Congress, were it not for the power of mental health care and the stability it has brought to my life. So, I champion the cause of mental health from a place of lived experience. And, I'm a person of many identities. Right? I'm Black, I'm gay, I'm Latino, I grew up in poverty, I'm from the Bronx. But the one identity that connects to everyone is mental health. It's profoundly universalizing and humanizing. People who have nothing else in common with me can connect deeply to my own struggles with mental health. It's the great equalizer. And, every one of us either has struggled with mental health challenges or we know someone in our lives who has had those struggles. So it should be a natural candidate for bipartisanship in Congress.
I just want to take a moment to thank both members for opening up and being vulnerable with us right now and sharing these personal stories. It's not only brave, but so important for folks to recognize that mental health and struggles with mental health, striving for healthy mental health is something that we have to talk about more. That talking about it more can help to lead to change. Do you find that we are starting to talk about mental health more? Is it becoming less stigmatized? And we'll get into the stigma a little bit later in the discussion, but is there a change happening?
About a year ago, I was one of 4 members of Congress who had an interview with ABC News about mental health, and each of us, we were telling our stories. And I said, look, the fact that you have 4 members of Congress openly telling their stories about mental health is a sign of how far we've come. The fact that it's only 4 out of 535 is a sign that we have a distance to travel. So we're making progress, but the mission is far from accomplished.
Absolutely. Congresswoman, you headlined a mental health event with the Hill last fall. Thank you for joining us again. What progress can you share from the Task Force on Mental Health since you spoke with us in the fall?
Well, I think the biggest progress is, and I give a shout out to David Trone, is he's very involved, and he's the one that got me involved, and we've passed legislation. But I think the biggest advance that we've made is legislation is just a small piece of it. We need resources, and we need a lot of them. Yeah. I mean, quite frankly, and although we've made progress, and I agree with what you said, we've made so much progress, but if here's the starting point and here's where we need to be, we've only moved to about here. Mm-hmm. There's a long way to go, and yes, it's legislation, but it's education, right? From doing these events and talking to people, the progress that needs to be made is so much greater than the progress that we've made, but again, you have to start somewhere. So the legislation is bipartisan. It is one of the things that we do work. Mental health has no political boundaries, right? It doesn't care if you have brown hair, blonde hair, if you're African American, it doesn't matter, right? So it's one of the things that I think that can unite us and bring us together. And I think it's something that people truly care about. So we've made progress on the legislation, but it's really minimal. I mean, you just look at my state of Michigan, all the people that have mental health issues, the bulk of them are in prison. That's not where they belong, right? I go to the healthcare centers in my district, and patients have been in the mental health, they go in for emergency or whatever, and a lot of times those patients are there for 100 days. 100 days because they don't have a bed or they don't have a room for them in a mental health facility. That's a problem. So as much as we can say, oh, we're passing legislation and it's great, it is, but we need to see sweeping changes, actionable changes, right? For you to spend more than 3 days to even get evaluated is unbelievable. If you had cancer or a broken leg, we would be up in arms about that. So we have made progress. I don't want to be a downer, but we have got a lot more progress to make, and it's resources.
Part of those resources also mean resources for access. And Congressman, as you shared today about how medication can help ensure healthy mental health, you've also touched on how access to medication can be a major challenge for many Americans. Can you talk a little bit more about that? And is there anything that legislation can do to help that?
Of course, both legislation and resources. I mean, even though the experience of mental health is universal, the lack of access to mental health care disproportionately affects the lowest income communities of color. There's a severe shortage of psychiatrists and psychologists in our society. Even if you have insurance, you could wait months to see a psychiatrist. There are many, maybe even, I don't know if it's most, but many psychiatrists do not even accept insurance. And so it's just in my own personal life, I began experiencing depression when I was in high school. I went to a chronically under-resourced high school in the Bronx. I was one of 5,000 students. When you're one of 5,000, you can easily disappear as a statistic into the bureaucracy. And look, I had no conception of mental illness when I was in high school. So I had no vocabulary for what I was experiencing. But there were no psychologists in the school. There were no psychiatrists in the school. There might have been a social worker, but I thought, I would only go to my social worker to pick up my report card.
Maybe.
Or my guidance counselor. There was no real guidance or counseling. It was just, here's your report card. Yeah. And so it was a coldly bureaucratic atmosphere. And I had asked myself, if I had gained access to mental health care when I was in high school, then maybe all the tragedies that followed would have been prevented. And so as a congressman, I've secured about $8 million in funding to expand the largest network of school-based mental health centers in the Bronx. Wow. Because I feel, our schools are a natural hub of social services and health services. It's in loco parentis for many people. It's the second home.
Yep, I agree.
A little bit about the personal work both of you have been doing. Congressman, you have established the Clubhouse Caucus. Can you tell us a little bit about that?
Yeah, I'm a strong supporter of the Clubhouse model because of its simplicity. I feel like the starting point should be a recognition that those with mental illness are no different from everyone else. Like those of us who struggle with mental illness, including severe mental illness, have a need for community, a need for love, a need for dignity, a need for a sense of belonging. And I've always felt that community centers, senior centers, and clubhouses, which are specifically designed for those with serious mental illness, that can be an elegant solution to the problem of loneliness. And so I've made it a personal mission of mine to promote the Clubhouse model throughout the country, and it's been a resounding success in the Bronx.
Congresswoman, you are the president of the North End support team in Macomb, just making sure I'm pronouncing that correctly. What's something you have learned, and you've touched a little bit on this in our discussion today, about how drug use, addiction can either impact or be part of mental health?
Well, a lot of the times what I've seen from my experience is it usually starts with people start to self-medicate, right? And the whole reason why we started the drug court in Macomb County was right after the passing is I started listening, right? I started listening. It's all around us. We just don't take the time to listen and to open our eyes to see. We only see what we want to see. So I started seeing what I wanted to see, and there was a real issue in our community with mental health that, listen, I'm not a doctor, I don't play one on TV, but it's common sense. You can see that when I have a mental health issue, I want help. There's no resources there or very limited, and typically the people that need those resources, that mental health resources, don't have the funds, don't have the access to it. So what do? They begin to self-medicate. Then what do? They they do an illegal activity, whether it's the drugs or whether it's stealing money to get the drugs or whatever it may be. And we were incarcerating all of these people. Okay, well then you incarcerate somebody for 30 days to put them in jail, to put them in the same environment with people who are just like them. That didn't help them, that hurt them, right? So what I did with other members of my community is we started a drug court, and we said, hey, listen, if you want to get help, if you want to get clean, we want to help you. We want to help you with your environment. We want to help you with a job. And we want to help you, not persecute you, but to help you get back on track. And if you can make it through the program 18 months sober, clean, whatever word you want to use, then it's not on your record, right? But we help you get jobs, we help you connect with counselors, we help you. It's so much bigger than that. Now, it's not big enough. I mean, we only graduate maybe 18, 20 people a year out of this program, but for our little community, I'm telling you, that makes a difference.
Absolutely. The work that both of you do, I think we can all acknowledge that government and Washington, D.C. in general are stressful, can take a toll. How do you find balance in your own life to help ensure that you are maintaining a healthy mental health?
You know, I probably don't do as good of a job as I should, right? I should work out more, I should eat better, but I think for me, the biggest mental health breakthrough that I had was to get rid of the anger, because you can be angry, and I was for a long, long time, or you can do something about it, right? That's what helps me. The second thing that helps me, to piggyback a little bit on what you said, Congressman, is I surround myself with good people. It is the key to mental health. If you surround I don't have to hide who I am, right? I can have a bad day, right? And I don't know if you've noticed, but people can be kind of mean in politics, right? Especially on that social media. It hurts my feelings. But I think it's the people that you surround yourself. I am blessed to have to be surrounded with people on my staff and in my family that truly care about me and that I can truly be myself.
I feel like I fail at the work-life balance.
Epically.
I do go to the member gym as an outlet. I do try to remain in touch with friends so that I can escape. I have this idea. I feel like the United States should have like a national tradition of Shabbat. What I appreciate most about Shabbat is that you disconnect. You turn off the phone for 24 hours. Not everyone turns on the phone, but imagine just having dinner with your family and disconnecting yourself from the overwhelming onslaught of social media and smartphones and connecting yourself to the things that matter in life, family and friendship. I feel like all of us would benefit. So I feel like there are simple solutions to the problems of mental illness and loneliness and stress and trauma in our society. And obviously, we in government are part of the solution, but there's a human element that can be powerfully transformative.
Yeah.
So in our last minute, then, I'm going to put you both on the spot here. 30 seconds. Speak to that human element. What is your call to action to our audience, both here and watching at home today?
Tell your story. Tell your story so that we can break the silence and shame and stigma that often surrounds the subject of mental health. There is liberation in the act of telling your story, and nowhere more so than on the subject of mental health.
Great. I think for me is lose the judgmental piece. I mean, I take that from myself. So many of us don't understand, so we judge. Lose the judgmental piece. Stop the labeling. I despise the labeling. We're all human. We all have struggles. It's just different varying degrees. The second thing I would say, be aware, open. If you just stop for a moment and stop looking inward and look around you, there are people crying for help every day. We're just so self-absorbed in what we're doing that we don't take a moment to stop and just look at the person next to us and be kind. I mean, it's amazing how a simple hello or a smile or a kind word, we've lost that. Those are the two things. I think one, you got to look inward. I know I did. I know that was a big smack in the face for me. And then just be observant around you and be open and welcoming. And the biggest thing is just be kind.
Congresswoman, Congressman, thank you both so much for joining us today and for sharing your stories. Thank you.
Thanks so much. Don't get that on film. Neither one of us
No.
reelected.